Welcome back to Getting Ready for Birth. In part 2, we'll explore each of the phases and stages of labor in greater detail. Your labor will begin in early labor. Here, contractions last 30 to 40 seconds each, and they may be quite spaced apart, happening every 15 or 30 minutes in the beginning. Your water may break during early labor, but this doesn't necessarily happen so soon. You'll want to notify your provider when you think that you are in labor, or if your water has definitely broken. If your water has broken, they'll ask you a series of questions. What time did it happen? What was the amount of fluid you saw? Was it a big gush or a little trickle? What color was the fluid, and was there any odor to the fluid? Normally, amniotic fluid is clear and odorless, but if you notice a murky green or brown color or a foul odor, it could mean that the baby's in distress, or it could be a sign of infection, and you may need to go to the hospital sooner than later. Otherwise, one of the best places to spend early labor is at home where you're most comfortable. During early labor, the cervix is dilating from 0 to 6 centimeters, and the baby is dropping and rotating in the pelvis. For many people, early labor is fairly easy to manage through a variety of comfort measures, such as movement and breathing and rest. Emotionally, most people are feeling a combination of excitement and anxiety. They can usually still follow a conversation, and they'll still have a sense of humor about things. Here's a list of comfort measures you can consider using during early labor. Notice the bubble off to the right. How can your support person or your support team help you through all of these different comfort techniques? Again, stay home if possible. Get as much rest or nap if you can. A warm bath or shower can be great for releasing pressure and discomfort. You'll need energy, so do have light snacks and drink plenty of fluids. Avoid acidic things like orange juice that might upset your stomach. You can take a walk or watch a movie to distract you and keep you moving. You could ask for a massage, and finally you can finish packing that hospital bag with last-minute items. Your labor will progress from early labor to active labor. Here, the cervix is dilating from 6 to 10 centimeters or fully dilated. Emotionally, you may start to feel like you can't follow conversations as well, and you may no longer have much of a sense of humor. Physically, contractions are lasting longer, about 60 seconds each, and they may happen every 3 to 5 minutes. If you're having back labor, where the contractions feel like they're in your low back, or you're having a particularly long labor, this could mean that the baby's not rotating down into the perfect place in the pelvis, and so movement again and changing positions can be really helpful. Here you can see a woman walking or pacing, leaning forward on all fours on a birth ball, or lunging on a stool. These things can be done in a lot of different ways, on a bed, off a bed, with a tub, again with a birth ball or a small chair. It's important to think about how you're going to get to the hospital and when you need to get to the hospital. We recommend not taking an ambulance to the hospital. This can actually slow down the process. In terms of when to go to the hospital, there's a simple formula you can use that usually indicates that you're close to or in active labor. It's called the 4-1-1 formula. This is when contractions are 4 minutes apart, lasting 1 minute each, and that pattern has been going on for 1 hour. This is an appropriate formula to follow if you're low risk and if this is your first baby. However, if there's a medical reason to go to the hospital sooner, or if this is not your first baby, you may need a different formula or plan with your doctor. Sometimes second or third time moms use a formula of 5-1-1, when the contractions are still 5 minutes apart, lasting 1 minute each, and that pattern has been going on for at least 1 hour. Some comfort measures you can try in active labor are, again, changing positions frequently. I've listed several here. You can stand, walk, squat, get on hands and knees, slow dance, sit on a ball, or sit on a chair. Breath work can be so helpful. Breathing deeply, moaning or sighing, keeping your voice low, or counting deeply through the contractions. You can visualize a quote or a picture that relaxes you. You can use cool washcloths or ice chips to cool down. You can use heat packs or a microwaved rice sock on your low back or any other points where you're feeling a lot of tension in the body. Massage and touch can be very helpful, although not everybody appreciates this during active labor. You could also use a tub or a shower if allowed. Emotional encouragement from your support person or your support team can carry you through this phase of labor. And finally, if you're at the hospital at this point, you'll have certain pain medications that may be available to you. In transition, it means you're almost there. The transition is the end of active labor, getting you from the final 8 to 10 centimeters dilated. It's the shortest and most intense part of the labor that demands a lot of focus and a lot of encouragement. Physically, you'll feel contractions lasting 90 seconds or more, and they're coming every 2 or 3 minutes, so the breaks in between are small, almost imperceptible. You may have the urge to push or bear down, which can feel like you need to use the bathroom. And emotionally, some people start to feel panic, that they no longer can stay on top of the contractions or breathe through the contractions as easily as they could before. Some comfort measures that can be really helpful in transition, again, are emotional encouragement from your support team, a hand to hold, slow, deep breaths, and if you do feel the urge to push, but it's not time yet, either because you're not fully dilated or your provider's not yet in the room, you may need to pant, or you can use what I call the birthday candle breathing technique. Imagine a huge sheet cake with hundreds of birthday candles lit. Take a nice cleansing breath in and short puffs of breath in and out to blow out each of those candles. This helps take pressure off of your bottom as you blow that pressure out. Pushing is the second stage of labor. There are a variety of different positions you can try when pushing. Off to the right, you'll see images of, again, women squatting, using a bed, reclining, leaning forward on a birth bar, or squatting on a squat stool. These different positions affect people differently at various points of their labor, and so going in with an idea of different things you can try can be really helpful. You're only pushing during contraction. During the rest breaks in between, it's important to rest. You'll need a lot of emotional encouragement from your support team, from the nurses and providers. As you begin to push, the baby is lowering in the pelvis and can begin to crown, where it first becomes visible to your provider team. As the skin and tissue stretches, many people describe this as a ring of fire. You can slow down your breath, slow down the pushing to allow that tissue time to stretch. If you don't feel the urge to push, and this is more common if you've had an epidural that numbs the sensation around the pelvis and the lower part of your body, you can ask for time to labor down and wait until you naturally feel that urge to push. It's also very common to have shaky legs when you're pushing. The final stage of labor, stage 3, is the delivery of your placenta. Placenta is a 1 to 2 pound organ that you grew just for this pregnancy. It's been the source of food and oxygen for the fetus all this time. The placenta attaches to your baby, to your uterus on one side, and the umbilical cord on the other side. As the placenta is delivered, it's going to be pushed anywhere from 10 to 30 minutes after the delivery. The umbilical cord could be attached this entire time, but normally it's clamped and cut shortly after the birth of the baby. Your provider is going to inspect the placenta very closely to make sure that all of it was pushed out and that there's nothing remaining.